Have you been told that you've got gum disease, gingivitis, or periodontitis? Well, what does that mean? In our mouths, we've got bacteria. If we have bacteria that thrive and haven't been washed out, what that bacteria will do, will then find a home to live in, usually around the gums of our teeth. What ends up happening then is our body tries to fight that bacteria and it creates some level of inflammation. At an early stage, we call that gingivitis. Later on, if that bacteria has been around for a long time, we call that periodontitis, and that is involved with not just gum recession, but also bone loss. Once there's less bone around a tooth, that tooth could get loose, and that is what periodontitis is. For example, in this model over here, we've got a little bit of recession around these teeth over here. These teeth aren't anchored nearly as well than the neighboring teeth, and so what we end up having is some bone loss, which then could lead to loose teeth and loss of teeth. Usually to fix something like this, we have dentists and dental specialists who will then treat that periodontitis with something called a scaling and root planing, also known as a deep cleaning. That deep cleaning allows the hygienist or the doctor to go deeper under the gums and clean out some of that bacteria, at which case the teeth can have a stable point. That periodontitis or gum disease will have been cleared up, but then requires annual maintenance, maybe 3 or 4 times a year, to make sure that that gum disease doesn't get out of control again.